Okay, then I'll just start the lecture. Let other come. Okay. So today we are going to see the changes after cell death. What are the changes happen? In this, we are going to cover the topic gangrene, and they have two types of it. Okay. So after cell death, the two main changes happen. First is gangrene, means there's a cell death of a particular area. Okay, and there are two type. After necrosis, necrosis is like there is no supply of oxygen. So what is happening? That area is all the cell, all the content of the cell is getting dead. Okay, so the gangrene is a response or a ultimate cause of the necrosis. The other is pathological calcification. In this, what happened after the degeneration of the necrosis? What are the things happening with calcium and sodium, the content of the cell? Okay, they are getting calcified. Some are getting large amount of sodium. So we'll just cover today that. So first we'll see gangrene. So there are, everyone has might have heard about this term or even saw that patient in their life of gangrene. Okay, it's mainly happen when there is atherosclerosis, means there is no supply of oxygen to the arteries. Okay, to particular area. So there are two type of gangrene. One is dry gangrene. The other is wet gangrene. Okay. So we'll just see in detail what are the differences and what are the bifurcations we can see in dry and wet. So this is a coagulative necrosis. As we have seen it, there are 5 types of necrosis: coagulative, liquefaction, the last time we have seen, fibrinoid, liquefaction, fat necrosis, and cessation. The first was it's because of the when there is no supply of oxygen, when the oxygen has been destructed to some particular area, and that leads to inflammation of that area. That is that is the cause of this gangrene. Okay, on the other hand, gangrenous or necrotizing inflammation is characterized by primarily by the inflammation provoked by virulent bacteria, result in massive tissue necrosis. Thus, the end result of necroinflammation gangrene is same, but the way of to produce is different. So, what they are saying is both gangrene end results is same, but how they have been seen or on what area, because of the on the basis of the area and exposure, they are differentiated in dry and liquid, dry and wet. So the dry mainly seen in the distal part of our body, whereas wet has been seen mainly in the area where there is mucus formation or around the mouth, when there is a wet area, is there organ surface of the organ. So this is the main difference between dry and wet. Okay, so first we'll see dry. The first is this form of gangrene begins in the distal part of the limb due to the ischemia. The typical example of dry gangrene is in the toes and feet of the old patient due to severe atherosclerosis. Okay, have everyone heard about this Berger disease and Renault disease? It's very important. It's mainly seen in our arms, forearm or something. Okay, the main thing what happened, Burgess, is the arteries. In that arteries, they get swollen up, or there is no supply of oxygen through that. So it mostly seen in the forearm, the Burgess disease and Renault. The cases which you can find this kind of patients are mainly in fracture, when there is has been open fracture or something and they have been strapped down. So some of the arteries get damaged in that accidents or something is happening. So mainly in those cases after fracture, this is the consequences you might see in the patient or the complications. Okay, the complication of fracture, you can see this Burgess disease and Renault disease. Anyone is having any compressive disease or any compressive uh, accident or something, in those cases we see such things. In this, what happened? The arteries are not able to circulate the oxygen, or there is no supply of anything. Blood circulation is stopped along with that oxygen. Okay, so this is usually initiated in one of the toes, which is the farthest point of the blood supply, containing a little blood that invade even the invading bacteria. So what happens in this is sometimes there is no supply even for the bacteria to grow. So what happened? The bacteria keep on growing in the low pace, very slow process, because there is no oxygen, or there is no what we say culture for the development, or the development of the bacteria over there, because there is so disruption of the oxygen level. But to some extent the inflammation happens, and this process, the growth of gangrene, is very slow in those regions. Okay, and it grows till the region where they have the optimum oxygen supply. So what we can see, you can see a bifurcation in the skin as well, the gangrene and the normal skin. Till the circulation is normal, till there you can find this gangrene. Okay, so the gangrene spreads slowly upwards until it reach a point where the blood supply is adequate to keep the tissue viable. The line of separation is formed at this point between gangrenous part and the viable part. Okay, so in the dry gangrene, what is happening? What are the main points? If I ask you to write a note on gangrene, so first you will just give an example, or you just give a definition of it, that it is a end result of a necrosis. Which type of necrosis? The first type of necrosis. Okay, causative necrosis. And then you will just coagulative necrosis, the first type of necrosis. Then you will just go in the dry and wet. In dry, what are the points? First, it's been seen in the distal part of the body, majorly toes and feet. It happens due to the disruption of oxygen in the arteries. So atherosclerosis might be the reason, Berger's disease. Any compression happens in the compartment of muscles, that leads to disruption of the oxygen as well. So majorly as a complication of fracture or something you can see. And for example, you have to mention Berger's disease and Renault disease. These two are important. Okay, then you will say, then you will include those things, how it initiate in the toe, and it's a very slow process. It happen till the point where the oxygen supply is optimal. So when to the extent, let's just say it started from the toes and to the midfoot, or till the ankle, till the malleolus, all the arteries are working fine. So the gangrene would be at the level of ankle. It won't spread in those areas where the supplies are there. There won't be necrosis, there won't be any inflammation. Okay. So that would be a thing. And then a line of separation has been seen in that. So morphological features is for something you to understand it. You don't have to mention in exam, or you don't have to write it down. But for your knowledge, you should know what are the morphological features of gangrene. The affected part is dry, shrunken, and dry black, resembling the foot of mummy. It is black due to liberation of hemoglobin from the hemolyzed red blood cell. Why it is black? Okay, so there are two reasons that it is black, because there is no supply and there is nothing to make it liable. Okay, everything has been destroyed over there. There is no red blood cell, there is no other sodium, potassium, anything. So everything feels like burn, or there is a pus formation thoda sa, or is majorly they are dry in state. Okay, the line of separation usually brings about complete separation of eventual falling off of the gangrenous tissue if it's not removed surgically. Sometimes what happens in those regions in the village or something, this take place, but they are not aware about it, or they do not go to hospital or something. So what will happen in the last stage, if nothing has been done for months, say more than 6 months or something, so that limb will fall out, that area will break, because there is nothing, no support, because sooner or later the even bones have been affected in this first tissues, for cell tissues and the muscles, and then eventually even the bone is affected. So what happened? It falls out. So that is the last. thing that happened. So now we'll see the wet gangrene. In wet gangrene, what happened? It occurs naturally in the moist tissue. Okay, where you can find some water circulation or blood circulation, where is the mucus formation is there, like our organs, near our organs or in our mouth, due to our saliva and everything. There's a wet area. Okay, so what are the region? Bowel, lungs, mouth, cervix, vulva. Those are the region where you can find such type of wet gangrene. So other two main is this has been seen, everyone would have seen or heard about this in diabetic foot due to increased level of glucose. Also the healing is very less. Has been known to everyone. Okay, so that also reason that this gangrene gets so bad in diabetic foot. They are very much prone to not healing the tissue. So what happened whenever the diabetic patients are getting injured in such areas, the recovery time is very low. Okay, so if proper care is not been taken, okay, along with that their oxygen supply is very less due to some compression or due to some muscle atrophy or hypertrophied or any certain reasons, the supply is very less. So what will happen, there will be a diabetic foot or there would be a necrosis over there and gangrene, ultimate gangrene. So in wet gangrene, there's two more example to that is one is diabetic foot and the other is bed sore. So now what happens in bed sore is when the patient is paralyzed, mainly when patient paralyzed or has been on bed for months for certain reasons. They are in coma or they are been Parkinson patients or anything related. They have been for months. They have been on bed. So what happened? They starts getting bed sore because the bony region will compress those muscle and ultimately they even compress some arteries or veins around it, so that lead to this bed sores. Okay, so diabetic foot is which is due to high glucose contained in the necrosis tissue which favors growth of bacteria. Okay, that is one reason. The other is bed sore occurring in the bedridden patient due to the pressure on the site like sacrum, buttocks, and heel. Those are the regions where the bones are very prominent and superficial. And due to the gravitational force or due to the lack of movement, there's a direct pressure on that those muscles. You can see a hole or something, and there is like a particular hole you can see in their muscles. You can get black, and you can look through their muscles as well. So it's that bad. So these are the two. So in wet gangrene, you have to give the definition and then you have to give this example as well. Diabetic foot and bed sore. So what happened over here is the affected part is stuffed with the blood. Okay, here we do not have the means there is no supply or it's very dry. It's not. There's a proper supply around it. So favors the rapid growth. So in dry gangrene, what happened? There is no supply. There was nothing because in Burgess disease and Raynaud, what happened? There is no blood supply. So that leads to no supply of oxygen. But in this case, it's not the same. In this, there's a blood supply and there is a huge supply of that. So what happened? The growth of bacteria is very rapid in wet gangrene, whereas in dry gangrene, it's very low. So the toxic products formed by the bacteria are absorbed, causing profound systemic manifestation and septicemia. And finally, the death. The spreading of wet gangrene generally lacks clear-cut line and demarcation and may spread to peritoneum or peritonitis. Peritonitis is a layer which is found in our bone. Okay, so it might even affect the bone as well, and there is no bifurcation because in this, even at the area of gangrene, we have blood supply and we have to some extent, we have the proper blood supply. So we cannot see the proper bifurcations in the skin. So morphologically, we'll see grossly the affected part is soft, swollen, rotten and dark in color. Classic example of gangrene is a bowel, commonly due to the strangulated hernia, bulbosus interceptions. The part is stained dark. What happens in hernia is everyone knows कि due to the leg support or the weak muscle or the ligament or the fascia is so weak that it cannot hold the pressure of the organs. So what happened? This lower abdominal, the inguinal ligament, mainly there we can see hernia. The inguinal pack or in the inguinal sac is not holding properly or it's very weak. So the small intestine just go through it or the abdominal cavity is coming out of that. So that is the commonest point where the wet gangrene has been observed or you can see such cases easily. So other is gas gangrene. It's a very rarely seen and it is affected or it is done. Uh, it has been seen or caused due to the bacteria. There is nothing oxygen disruption in this, but it is due to cause of affected by the bacteria, certain kind of bacteria. It is specially formed of wet gangrene caused by gas forming Clostridia. It's a gram positive anaerobic bacteria. It grows in those cases where there is no oxygen. So particularly there's a bacteria behind this gangrene which gain entry into the tissue through the open contaminated wound, especially in the muscle or in the complication of operation or colon, which normally contain Clostridia. So what happens whenever the wound is open, as everyone knows, it's going to be like open or it's not been taken care properly. So such bacteria grows. The particular bacteria is the name is Clostridia that has been seen mostly in the wounds or even in the operation theater operation while doing while operating them if there is some level of infection or proper hygiene is not being maintained, so there is a chance to grow a gas gangrene as well. So morphology is same. It's swollen, edematous, it's painful due to accumulation of the gas bubble and carbon dioxide within the tissue formed by the fermentation. So as we have seen gangrene, uh, the changes after cell death, the first was the gangrene. We have covered dry and wet gangrene. The other is pathological calcification. This is the second thing that happened after the cell death. When the cell is dead, there is no function in the cell. The other thing is happening is pathological calcification. So in this, what happened? There is a deposition of the calcium salt, okay, in tissue other than osteoid or any enamel. Is a pathological and heterotrophic calcification. In this, there are two main part is you don't have to go in this detail. You just have to remember this one. There are two. First is degradation of the tissue. There's like dystrophic calcification and the metaplasic. Okay, we'll cover both. This metastatic calcification and dystrophic calcification. So as apparent from the definition, dystrophic calcification may occur due to two type of cause. First is calcinous necrosis, calcification of the dead tissue, or the calcification of the degenerative tissue. Now degenerative tissue will be seen where once the dead tissue is there and it's been a longer time, there is a degeneration of everything happening over there, the muscle. Now we are just talking about the cell, that is the cell death. But degeneration is about the muscle, the nerves, the arteries, and everything. That is the last stage of necrosis. Okay. So calcification is what the deposition of the calcium salt. So there would be two stage in that. The calcification. First, the accumulation of the calcium salt in the dead cell, and the other would be after the degeneration of this tissue. Okay, this two would be the thing. So in this first, you just have to give the name or you just have to give the definition of it because it's the bacteria and it when it happens or what are the reasons. You don't have to go into that depth. So in the calcification, you just have to write dystrophic calcification. In that we have two. The first is Calcification in dead cell. So first would be cessation necrosis. In TB is the most common site for dystrophic calcification, leaving bacilli may be present even in calcified tuberculosis lesion, lymph nodes, lungs. So here we have where are the places you'll be able to see such calcification of the dead cell. So mainly here we have nine things. Okay. The first is calcaneus necrosis in TB. In those cases, you will be able to see. The other is liquefaction necrosis in chronic abscess. Liquefaction we knew when there is a wet or mucus formation is there, when there is it's around the organ or where there is a lot of mucus, there we can see this kind of necrosis. Liquefaction necrosis. It's seen in the chronic abscess, may get calcified. The third is fat necrosis following the acute pancreatitis. Even fat, as I told you, where the fat metabolism is happening to high level in our body, there are two basic region. One is pancreas and other is liver. Majority of fat metabolism is happening over there. So the third would be fat necrosis following the acute pancreatitis necrosis, and the breast result in deposition of the calcium soap. The fourth is gamma gangibodies. This is a chronic venous congestion of a spleen. It is characterized by the calcific deposition. Okay, in this you can see when there is a venous congestion. The fifth is infract. Infract is what? When there is no, what do you say? There is no supply and there is like a for example, I'll give you when you tie your finger na, with a rubber or something. So what happened? There is no supply of blood. Afterwards, what will happen? There won't the tissue would be damaged, and that so that region is known as infract. Okay. So in those things, thrombi, everyone knows it's seen in venous veins of our body, especially veins produced by the fibrillatus. Any blood clots you see, even when we puncture our muscles for blood donation or something, those are the small region. Even when there is suction or any damage is happening when someone hit you or something, so small part of the muscle gets blackish in color. That is due to the this region, the due to the this reasons, fibrillatus. There is an inflammation of vein. Hematomas mainly seen in bone. Okay, the region in the bone, they are under calcification. Dead parasites highly in the cyst or cystoma eggs. These are the example. Microcalcification, this is seen in the breast cancer. So you don't have to write all this thing, but just for your knowledge, you should know. You just have to write calcification in dead cell and calcification in degenerated tissue. Because these are the region where you can find them. In the degenerative tissue, where are the places? First is dense old scar, erythromas, that would be the region. Stroma of two in tumor you can find, in thyroid you can find, in the tumor cyst formation is there. So these are the region where you can find this calcification. Now the other one is metastatic calcification. This is due to the hypercalcemia, means too much accumulation of it. Okay, so since metastatic calcification occur in normal tissue due to hypercalcemia, it is caused would due to either following. First is excessive mobilization of the calcium from the bone, or excessive two reason would be there when there is a too much supply of the calcium or there is too much absorption of the calcium. Okay, the first is excessive mobilization of the calcium from the bone, and other would be excessive absorption of the calcium from the gut. So reasons would be hyperparathyroidism. Okay. The second would be bony destructive lesions are there, hypercalcemia. There's a syndrome which is seen in breast cancer. When there is a prolonged immobilization, when you see any disuse of muscle or bone, this leads to that. The other would be when there is an excessive absorption of the calcium from the gut. when there is a high level of vitamin D. Okay. Idiopathic hypercalcemia infancy, that is a syndrome, Williams syndrome. The other would be renal causes such as renal tubular acidosis. What would be the site where you can find such things? Would be lungs, stomach, kidney, blood vessels, cornea, and synovial. Okay. Is this clear to everyone?
Yeah,
Yes,
ma'am.
ma'am.
Okay, this is the thoda lengthy part. Okay, I know, I understand that it's very lengthy, but you don't have to remember everything. You just have to have a clear concept, because you won't be getting in depth. Okay, what is calcification? We do not even see in such reports in our cases. But yeah, gangrene is important. Those are the patient we see, and even diabetic patients we see in our cases. So you can advise them, and you can know, okay, what are the things happening in them. Okay.
Right, madam.
Mhm. Today, should I continue this or should I keep it like that? You want me to complete this adoptive disorders?
Continue, madam.
Huh? Okay. Okay, so adoptive disorders is nothing but whenever the physiological changes are happening on a body. Okay, when you're using your body too much. So, what are the changes happening in muscle? When there is no use of the particular region, what are the changes happening? So, for example, I'll give you when there is a paralysis. Okay, what happened to those patients, or when there's a fracture and conservatively treated? So, what happened that muscles go in atrophy. When someone goes in gym or do regular jogging, what happened? They have hypertrophied calves, or the muscle bulk is increased. Okay, these are the changes that we see physiologically in the muscle level. So that is nothing but adoptive disorders. Okay, adoptive disorder are the adjustments which the cell make in response to stress, which may be physiological needs, any adaptation or anything, or non-lethal pathological injuries. Reasons can be anything. It can be, fracture. It can be someone being paralyzed, or those are the things. So it is bifurcated into two: physiological and pathological. So there is nothing. First is we see is decrease or increase in their size. So if there is a decrease, it is known as atrophy, increase hypertrophy respectively. By increase their number, hyperplasia and paraplasia by the growth, new growth, more growth of a new cell. Okay. The other is change of the pathway phenotype differentiation cell, metaplasia, dysplasia. Means there's a transformation of certain tissue, or there's a new development. It's like some people have a lump of a muscle. If you have seen, how do I explain? Um, have you people seen those cases with DVT? Okay, in those what happened? The reason the muscle goes in atrophy, as well as certain muscles do not move to, they move to some direction. They have lumps in their calves. Okay, so when there is a overdevelopment in certain region and there is a atrophy, so those are the things. When pathologically what happens, there is a changes in the muscle or tissue. Okay, now in general, the adoptive response are reversible on withdrawal of stimulus. However, if the irritant stimulus persists for long time, the cell may not be able to survive and may either die or progress further. Okay. The various mechanism is there for the adoptive cellular response. First is altered cell surface receptor binding, altered signal protein synthesis, and synthesis of the new protein. So what happened? Okay, these are the reasons. See, mainly when atrophy is happening, basically you need to understand when the atrophy is happening, the protein, or the protein which is necessary for the fibers, it's very reduced. Okay, when the hypertrophy happens, when there is a bulk, the protein content or the protein amount is increased, and even the fibers in the muscles is increased. Okay, so first we'll see the atrophy. Reduction of the number and the size of the parenchyma cell of an organ or its part which was once normal is called atrophy. So it's nothing but a basic definition. There's a reduction in what the number and the size of which cell, parenchymal cell, in organ or in any part of your body that can happen is known as atrophy. The cause mainly physiological or pathological. So they have given some examples that we'll see first. We'll go for the physiological. It are mainly seen with the ages. As we know, when there is when you see the patient with the age of 60, 70, majorly after 60 years or 70 years, they have that vasting of muscle has been seen. They don't have that bulk like us. They have loosen up, the skin are loosen up. So the anything that is happening because of the age, any physiological changes due to the endocrine system or something, that is the reason. The other pathological is something they got injured or they have to stay bedridden for some reasons. Those will come in pathological. The physiology is any atrophy of lymph node tissue with age, atrophy of thymus in adult life, atrophy of gonad after menopause, or atrophy of brain with aging, osteoporosis with reduction in size of bony tubercles. So these are the normal things, physiological changes that is happening. Even with the lesser amount of testosterone, it's seen that the muscle fibers are not coming to that extent and the tone of the muscle goes down in male and female estrogen. Okay. So the other reason for the pathological atrophy is first is starvation, second is ischemia, any neuropathy, fasting, disuse atrophy, it would be prolonged diminish of the functional activity. As I told you, okay, because of any reason that they are not able to use it. So there you will see fasting, disuse atrophy. Neuropathic is this when there is nerve damages, the paralysis, motor neuron disease, poliomyelitis, Duchin atrophy. There's a main disease which comes under this is Duchin atrophy. Have anyone heard about this? Duchin atrophy. So it mainly happens to the children. Okay, basically to 5 years or something. It's genetic. Okay, the nerves are not working, and very rare cases you will find some of the people at the age of 18 or 19. I've seen one patient which was he was like 19 years old. So initially what's happened, the muscle bulk start reducing and it starts from your calf muscles. Okay, the nerves are not working over there at all because of the some DNA or neurological condition, but that is the reason. So whenever it comes neurologically, it's due to the interruption of any nerve supply. If the muscles are not able to work or they are not pumping or there is no movement, so eventually we will see atrophy in those muscles. Any metabolic activity or tissue, endocrine atrophy is loss of any endocrine regulatory mechanism, hypopatriotism, thyroid, hypothyroidism, the skin, and in hyperthyroidism, what we see is there is an increase in weight, but in the same way, when there is a hypothyroidism, there is no circulation of the hormones is happening properly, so this leads to a decrease in number of muscle fibers in those people. Pressure atrophy, prolonged pressure from benign tumor or cyst, any compression that is happening, or any compression to the nerve root that is happening, and that leads to those things. Idiopathic is when we don't have any reasons. Those are the myopathy. Okay. So this is the reasons we will see in atrophy. The other is hypertrophy, hypoplasia. In hypoplasia, what happened? The number of cell is increased. Okay. In Dysplasia, number of cell decreases, but the content increase in that. So hypertrophia is nothing but the increase in size of parenchymal cell result in enlargement of the organ or the tissue without any change in the number of cell. Only the size of the cell increase, but the number of the cell is same. The cause is again same, physiological and pathological. Physiological is enlarged size of uterus in pregnancy. It is an example of physiological hypertrophy. Pathological is any cardiac muscle and hypertrophy of cardiac muscle when there is atherosclerosis or any blockage over there. So what happened? The muscle, the heart muscle has to pump more to circulate the blood. So that leads to hypertrophy of cardiac muscles. In such reasons, any stenosis is there, any hypertension, increased BP, that is the reason. Then hypertrophy of smooth muscle, intestine or muscular arteries, that happens because of the hypertension. What happens when there is a too much of pressure and there's a blockage in arteries or any region? So what happens, there will be a more muscle work or more artery work has been seen on those areas, and that will lead to hypertrophy. The other is skeleton muscle, mainly seen in manual laborers or anyone athletic who are regular in their gym. So those are the bulk, they have bicep bulks, or the cuts they have, uh, shoulders. Those are the things. The other is compensatory. What happened in this is this may occur in the organ when the contralateral organ is removed. Okay, just imagine sometimes what happened, the bile is removed, the pancreas is working too much. Okay, so the sometimes what happens, they do not remove the whole bile or the whole pancreas. Sometimes they remove the spleen. So when we remove the spleen, the stress is coming on kidney. Okay. See, the nephrectomy, one side of young patient, adrenal hyperplasia, removal of the adrenal gland of any young patient. Those are the example. Okay, now hyperplasia is nothing but when there is an increase in number. In hypertrophy, there was an increase in size, but in hyperplasia, what happened? The number of cell are increased. Okay, so the region or the organ or the tissue get really big, mainly seen in the cancerous tissue. Okay, any fibrosis that you can see in patient nowadays, you can see laparoscopy has been done in uterus or something. They remove the uterus. So those are the things when the number of cells are increasing. There's a fibroid, maybe 13 centimeter, 15 centimeter, depending on the region. But these are the examples that mainly we see those things in cancer patients. Hypoplasia is an increase in number of the parenchyma cell, resulting in enlargement of the organ or tissue. Quite often, hyperplasia and hypertrophy occur together. Hyperplasia occur due to increase in recruitment of the cell resting phase or the cell cycle. Mainly, which cells are involved in this are the epithelial parenchymal. The region when you can see is liver, kidney, any thyroid, can undergo in the permanent cell are the neuron or the cardiac. In cardiac, what happens? They do not come to the back normal size. What happens when there is a hypertrophied, even though there is no load, the size or the size of the cardiac cell remains the same. Okay. The physiological where you can see is the hormonal hypoplasia in pregnancy, in female breast during the pregnancy, and even lactation or puberty. In compensatory, we can see in the organ. Okay, for example, when there is a part of liver has been removed due to some reason, so that the other is you can see in the kidney. And pathologically, more example of pathological hypoplasia is excessive stimulation of the hormones or growth factors. Okay, in wound healing, you can see formation of the skin rods, the layers which we find just above our wounds. any duct in the fibrocyst change in the breast, any unhealed ulcer. Those are the pathological reasons. The other is metaplasia. It is defined as the reversible change of one type of epithelial and mesenchymal adult cell to the other type of adult mesenchymal cell to the abnormal stimuli, or often reverse back to the normal or removal of the stimuli. There are two type of cells that has been affected in this. First is epithelial and other is parenchymal. Okay. In epithelial, what happened? The most common type is in patchy or diffuse, usually result in replacement of the stronger but less well specified epithelium. However, metaplastic epithelium being well specified, such as squamous cell, results in deprivation. So, okay, this, for example, I'll give you. Whenever our cell we are growing, okay, the young children having certain kind of cell, so they have been replaced with a stronger cell. Okay, this mainly seen in the growing people when there is a change, when there is a change in length or size. So what happens? The epithelial cells are changed to the stronger one as a squamous cell. Even in such conditions like in bronchitis or any lung disease that is happening, that in those cases we see squamous metaplasia. This is more common. Various types of specialized epithelia are capable of undergoing squamous metaphasia change due to chronic irritation that may be mechanical, chemical, infective in origin. Some common example is first would be bronchus. Chronic smokers are there in them. You can see there's a replacement of cell. So in this, what happens? A certain kind of cell is been replaced with different kind of cell due to some infection or due to some irritation or due to some stimulus. It's like too much of smoking, the cilia would be damaged, and the cell structure, the cell size and number would be the same, but the epithelial cell won't be the epithelial. They would be replaced by squamous cell. So those are the changes you can see in them. The other is mesenchyma metaplasia. This is less often seen, and this is a transformation of one adult type of mesenchymal cell into the other. The example mostly seen in the arterial wall of the old age, the cartilage of larynx and bronchi in the elderly people, in scar of the chronic inflammation prolonged duration in a fibrous region. The last is dysplasia. Okay, this is most oftenly see majorly what are the main parts are the metaplasia and dysplasia. Okay, in dysplasia, what happened? Dysplasia means disorder cellular development. This is again seen mainly in the cancer or any increased meiotic activity, any increased activity of the nucleus, or those are the any changes that is happening in the cell in an increased manner. This happens. Okay, it is referred as a atypical hypoplasia. Dysplasia occur most often in the epithelial cell. Okay, it is characterized by the purification and changes are increased number of layer of epithelial cell, disorderly arrangement of the cell, loss of basal polarity, means the nucleus is not working properly, increased nucleocytoplasmic ratio. So what happened in this? The cell content is increased. The ratio of cell content increase in this. The nucleus hyperchromatism, increased mitotic activity happening in those region. And this mainly seen in the chronic condition. Okay, dysplasia has been seen in the chronic or high grade of lesion is there. Okay, in the squamous epithelial layer, these are the things will be seen. So dysplasic change often occur due to the chronic irritation or prolonged inflammation. On removal of the stimulation, the change may disappear in the proportion of the case. However, dysplasia may progress into the carcinoma. So this is mainly seen in cancer as well. If the stimulus or the irritation, what is causing it, has been not been removed. Is this clear? to everyone. Adoptive disorder. You just have to write down the definition. You just have to understand what are the changes is happening. What happened in atrophy, what happened in hypertrophy, in hypoplasia, the size increase, in other thing, the number of cell increase. And in one, what happens, the cell content, if it is epithelial, it change into squamous for the certain, so many reasons. You just have to know what are the things happening. You don't have to remember what is causing it. That would be okay. Understood? Is it clear to everyone? So on Monday, Monday or Tuesday, whenever next we have, I'll just take this topic aging and we'll complete our chapter. Okay? Any doubt?
No, ma'am.
Okay. Thank you.
Thank you.